Okay, so let's talk about a viral illness you probably think you already know all about: hand, foot, and mouth disease. And I bet, just hearing that name, your mind immediately goes to daycares and little kids, right? Well, if so, you're going to want to stick around for this, because this explainer is for the grown-ups. Yeah, you've definitely heard of it. It's one of those classic childhood things. The name itself just conjures up images of a kindergarten classroom, doesn't it? But here's the twist, and it's the whole reason we're talking about this today. If you thought this was something you just aged out of, like losing your baby teeth, you might want to think again. It is absolutely not just for kids. So, here's our game plan. First, we'll confirm that yep, adults can totally get this. Then, we'll get into why it can be so much trickier to diagnose in adults. After that, it's all about the practical stuff, prevention and treatment. We'll also touch on some rare but important risks, and then we'll wrap up with what recovery looks like and the key things you really need to remember. Right, first things first, hand, foot, and mouth disease, or HFMD, is a super common viral illness. And while yes, it most often hits kids under 5, adults are by no means immune. It's caused by a group of viruses called enteroviruses, and trust me, these viruses do not check for ID. But this is where it gets a little complicated for adults. The symptoms don't always show up the way you'd expect. In fact, they can look surprisingly different, which can make getting a diagnosis pretty tough.
Let's just look at the side-by-side. A kid might spike a really high fever, but an adult could be much milder, or you might not get one at all. Same thing with the sore throat. But check out malaise, that general, awful, feeling sick all over sensation. That can actually be way more intense for adults. And when it comes to the rash, well, that's a whole different story.
So here's the problem. You could feel completely wiped out, but then a rash pops up in really random places like your face or arms, not just your hands and feet. Or, and this is a big one, you might not get any rash at all, so you can see how easily you just write it off as a bad cold or maybe the flu. Now, one symptom that is pretty consistent is something called herpangina. It's basically the medical term for those awful, painful little sores or ulcers that show up on your tongue and inside your mouth. This is a real telltale sign in both kids and adults, and boy can it make eating and drinking uncomfortable. Okay, so now that we know what to watch for, let's get practical. How do you avoid this thing, and what do you do if you actually get it? Well, there's no vaccine for HFMD, so prevention is all about the basics. Things that should sound very familiar. It's all about good old-fashioned hygiene. Washing your hands thoroughly and often. Disinfecting those high-touch surfaces like doorknobs and remotes. Trying your best to keep your hands away from your face. And avoiding close contact with anyone who's sick. Simple stuff, but incredibly effective.
If you do get sick, treatment is really about symptom management while the virus just runs its course. Think comfort care. Maybe an over-the-counter steroid cream if the rash is itchy. It's absolutely crucial to drink plenty of fluids to stay hydrated, especially when those mouth sores make it painful. And things like eating softer foods or rinsing with salt water can really help soothe the discomfort.
Now, we do need to spend a minute on complications. And I want to be really clear here. These are not common at all, but it's still important to be aware of them. Let's start with the good news, okay? For the vast majority of adults, HFMD is a mild illness that just goes away on its own, no lasting issues. Complications are very rare. So what are these rare possibilities? Well, dehydration is probably the most likely, and that's simply because the mouth sores can make it so painful to swallow. In very rare instances, it can lead to viral meningitis, which is an inflammation of the tissue surrounding the brain. And then there's a really strange one. Some people report losing a fingernail or toenail a few weeks after they get better. It sounds wild, I know, but it almost always grows back totally fine.
All of this really points to one critical piece of advice. If you have any reason to think you have HFMD, just go see your doctor. This is especially true if you are pregnant. Any viral infection during pregnancy is something you definitely want to talk to your healthcare provider about.
All right, let's wrap this up. We'll look at the recovery timeline and then summarize the most important things to take away from all this. So how long does this thing stick around? For most people, the whole ordeal is over and done with in about 7 to 10 days. You'll feel better, and the symptoms will just fade on their own. A really practical question is, when can you go back to work? You're most contagious during that first week. So the general guideline is to stay home until your fever has been gone for a full 24 hours without any medicine, and your rash is starting to heal. This is just the best way to stop from spreading it to everyone you work with. And that really is the single most important takeaway here, because the symptoms in adults can be so mild or just so plain weird, you might not even realize you have it. So that awareness, just knowing that this isn't only a kid's disease, is the best tool we have to stop ourselves from passing it on to others by accident.
So it's not just a childhood illness. The symptoms can be tricky, but prevention is pretty straightforward. I'll just leave you with this question. Now that you know, do you think you could spot the signs in yourself or maybe in another adult? Definitely something to think about.